Hello, everyone. This is Dr. Bob Brown recording the fifth community update on coronavirus. A reader asked to change the title slides around a little bit so it's easy to tell which one is which, and I'll explain the picture toward the end. Over the weekend, I spent a lot of time reading, and I'd say two articles I thought were the most helpful for me. First is this TED Talk from Larry Brilliant, and yes, his name really is Dr. Brilliant. He lives up to it. He won the TED Prize. He was one of the doctors that helped rid the world of smallpox, and he talks about how we would rid the world of pandemics and stop them. One of the key things is early identification and early response, something that we and most of the rest, or a lot of the rest of the countries got wrong, unfortunately. But I think it's a good overview, recorded 14 years ago, but still very relevant today, obviously. The other article I thought was really helpful was Dr. Tom Frieden, the former director of the CDC, writing about not just what to do now, but what are we going to be doing next, and really telling us that we've got to plan ahead, and this is probably going to be affecting us for the next 6 to 18 months. And he kind of lays out the decision tree for how we're going to do this. And so, again, I'd highly encourage this article. I'll use a few slides from his article. So where are we now? Unfortunately, we're hitting the exponential growth curve across the country and across the world. You're seeing this go up. They took China off because it was already way down here now. Italy's almost doubled the Chinese deaths already, and it looks like Spain's following close behind, and United Kingdom could be next potentially. So essentially, we're seeing who our Philadelphias of the world are and who our St. Louis's of the world from this slide from 100 years ago. Hopefully, those of us in the middle of the country will be more like St. Louis. I think you also see a similar pattern happening across the country where some will be more like one versus the other. The challenge right now, again, we still don't know what the real case fatality rate of this disease is. I think we're getting closer. I do believe still the German and South Korean numbers are probably closer to the true, probably in the 0.5 to 1% case fatality rate. We're getting there too because we're finally ramping up our testing, although belatedly. Some of these numbers are wildly inflated. This is not true because they're not measuring enough people. Italy, they're so far behind. They're just focusing on treating the people they can so they can decrease their deaths. Their case fatality looks really high because one, they aren't identifying all their cases, and two, a lot of people who could be saved aren't because their healthcare system is overwhelmed. And this is what we really need to avoid happening. And I think we have a good shot that we may have done it in time, at least in Nebraska. So essentially, what we have to do is keep the need in line with our capacity. And so there's some websites out there that list what our bed capacity is for the state in this 5 to 6,000 range. So hopefully we can do that and avoid a situation like this or even like this where people die simply because they just don't have the care and we can't ramp up capacity fast enough. So there's a good way to estimate this using range of cases, infection rates from 30 all the way to 70%. So this is a worst case Italy scenario where so many people get infected. This would be a horrible situation for us to be in. Even in Lincoln, Nebraska, you could be talking 5 to 6,000 deaths. I'm reasonably confident we're going to avoid this situation, potentially be in this situation. And if we get lucky, we actually may be over here where we can keep our infection rates low because we did such a good job, I think, with getting our schools closed on a timely basis. And because of the social distancing I'm seeing here in Lincoln, O Street was dead, downtown was dead. Bad for restaurant owners, unfortunately, but may have actually stopped our epidemic in its tracks, I hope. You'll see this slide, which is somewhat helpful but also somewhat misleading. So it does point out that countries that got on things early, especially South Korea and Japan, were able to stop the epidemic in its tracks. The question is what's going to happen next. My daughter lives in Japan, and we talked with her a couple days ago on Skype. She says people are out and about, and actually they are talking about opening schools again in the next couple weeks because I think they did a great job of stopping its tracks. They were early with closing their schools. The Japanese already do a lot of mask wearing, don't touch each other much when they say hi, they just bow. So they've done a lot of good things already. So we could be like them in the middle of the country. What's misleading about this map is they have U.S. way over here, but this is absolute numbers, not rates. So U.S. is as big as Spain, Italy, UK, and Germany combined. So it's not accurate to put us on the same scale. It should be rates, and that would actually put us down here. However, I think if you split up pieces of the country, New York would probably be right on this line right now. They were a little slow in closing their schools, unfortunately, whereas Nebraska and some of those in the middle of the country may be more like in this line, I hope. Fingers crossed. There's been a lot of good visuals trying to explain this to people. I think part of the problem is that people just don't intuitively understand exponential growth, and that small tweaks can make a huge difference when we're talking exponential growth. And so the social distancing we're talking about can make a big difference. It's important to realize how much of an effect closing universities and schools had, because that's even way bigger than this. So imagine one kid going to high school with 2,500 people in the building. Every hour on the hour, everybody mixes and scrambles around through the crowded hallways, and they go home and repeat it day after day after day. You'd be from here to here just in one day, potentially, if you still had high schools open in a highly contagious disease like coronavirus. One of the best visuals I've seen, actually, this physician, or I think a microbiologist from New Zealand, showing exponential growth here, but the actions of just 4 people, how much can be limited. And so you may not realize your decision just to work from home today, not to go to that barbecue, not flying on that flight, could have prevented a whole tree of people being infected. And so the difference between here and here is the decisions of only 4 people. So imagine that multiplied across an entire community doing a good job with social distancing. And I think that's what we're already seeing here in Lincoln. We've got multiple scenarios. What we do not want is the mad free-for-all. We want to have something more like this containment strategy that it worked. The social distancing can do this for you, even if you're late on the ability to test, which we were. So hopefully we're there, and we'll hopefully be looking at one of these squiggly lines, which I'll get to in the Dr. Frieden article. So one of our challenges is that if we were in any of these simulations here, this, and maybe even this overwhelms our healthcare system. And so we want to do this because we do not want thousands of people dying in our community. There does come with a downside, though. In these simulations, you'll see the pink line is there are people who are immune, and eventually the infection burns itself out because people are immune at some point. Our extensive distancing strategy may work, but it also means we're not immune, so we may be this on the long haul. I don't think we want to do this. The United Kingdom considered what you might be called a controlled burn strategy, but they ran the numbers and realized how horrific that was and changed their mind. Hopefully they changed their mind early enough, but only time will tell. Um, so what you have to do is keep things below this overwhelming your health system level, and hopefully we've done that. Um, there is a chance that we are actually way over here, and we may even be able to prevent the potential 500 to 1,000 deaths in Lincoln, Nebraska. And so what it may look like, this is this plan from Dr. Frieden's article. It's kind of busy. Essentially what I think he's describing here is that by slowing things down early, we may have just a small epidemic. And after a while, after 4 to 8 weeks, we could probably sound the all clear, let people go back to school, work, open the restaurants again. And then if we have a really good detection strategy, we catch anything early, shut things down for a few weeks again. And we may have to do this for potentially 6 to 18 months until we have a vaccine. This obviously means a long haul, but would only have to do intermittent closures if we do it right, and we could prevent millions of people in the United States from dying if we adopt this kind of a strategy. And so this is what I hope all of our politicians are starting to look at now and starting to plan for long term. To do this, of course, we need to be up to testing the level of South Korea and Germany. We're not there yet. I think we're probably within hopefully 1 to 2 weeks of being able to do this. This would allow us to detect everything, get it shut down, and then we could be not shut for 4 to 8 weeks or maybe longer like we probably are now, but get to the point where we could just shut down for a few weeks at a time if we get cases blipping up, as long as we have that early detection, early isolation strategy that Larry Brilliant was talking about in his TED Talk. So the simple rules, we've talked about this before. If you are sick, stay home. Same if anybody in your house is sick, everybody should stay home. We've already closed the schools and most daycares, I believe. We're already doing a good job of social distancing, so this will work if we can adopt it. So now we have to adjust to the new normal. We have to keep getting about our daily lives. It doesn't come out, there are some silver linings here. One, my wife and I were empty nesters, but no more. We've got 3 kids back in the house, 2 of ours, plus a bonus kid, roommate of my daughter who needed a place to stay. Maggie's pretty happy with the whole situation. He likes having more people around. I'm learning how to use Zoom. My daughters have told me tricks like using spacebar to talk and mute, and also how to put a different background behind you so you don't look like you're just sitting in the office. Although they say they've actually been appreciating seeing their fellow students in their homes. It's been an interesting way just to see more about what people are like by looking at their homes. I really got a kick out of this Jimmy Fallon episode from his home. It was nice to see his daughters crawled all over him just like my daughters used to do, and that's why I use this. It reminded me a lot back of the old days, and a lot of parents kind of miss those days, so it was really kind of nice to see that actually. Lastly, for you, make sure you're getting out. You still need to protect your mental health, and going for a walk, getting some fresh air and sunlight will help that. Plus, it is just good for your overall health as well. The vitamin D is good for you also. Uh, be kind to our healthcare professionals. They're doing his best to try to prevent infectious people from infecting their people with diabetes and heart failure and things like that. So follow the directions, work with them. They're doing their best to preserve their protective equipment just in case things go bad. Call them before coming in if you're sick. Basic instructions for you. 80% of people with coronavirus will probably have mild infections, so just rest, stay hydrated, and acetaminophen should be fine for a lot of people. Distinguished from a cold or hay fever, this is mostly fever, cough, shortness of breath, and sore throat. If you think you might have coronavirus, call your primary care clinic and they'll advise you whether they think they can treat it at home, what instructions they may have to do as far as evaluation if it sounds worse, like you're having trouble breathing, and hopefully we'll have the ability to do rapid testing here in the next 2 weeks. So Hopefully this is helpful for you. These are the hats I wear. So I'm a public health doctor, but I don't work at a health department. I actually would do split my time between a health system role, nonprofit role, and elected official as our school board. All of these they overlap quite a bit with this, and so hopefully this is helpful to y'all.